I'm Taylor Stamper. I am going to be doing a pediatric assessment today. My patient is a 1-month-old boy. So as I walk in the room, I am going to start my general principles and safety practices. I'm going to wash my hands, gloves. So as I walk in the room, I'm going to go ahead and start my assessment. So how is baby reacting with mom? How is mom reacting with baby? Is she willing to help? All of those things. So as I uncover baby, I'm going to continue talking to mom. I'm going to ask her about the feedings. Is she breastfeeding? Is she on formula? Is he on formula? Does he have any acid reflux? How many wet diapers does he have a day? Ask about his bowel movements. Any GI upset, any other issues that she has concerns about. Before I begin my assessment, I'm going to look at baby, look at his skin. He's warm to touch. He doesn't have any lesions that I can see. I'm observing for bruising, signs of abuse. How he's dressed, is he dressed appropriately? Well, after uncovering him. So now I'm going to begin with his head. I'm going to take his little hat off. And I'm going to look at his hair. The length, is it dull, is it dry? The correct hair distribution. I'm going to look at the anterior fontanelle, the posterior. Are they sunken? Are they bounding? After I look at his head, then we're going to move down to his eyes. I'm going to look at his pupils. Are they dilating? Does he have his eyes open? Are they symmetrical? After I look at his eyes, we're going to look at his ears. You're going to pull down and back because he's under 3. I'm going to look in there and see if there's any drainage, anything to be concerned about. I'm going to look at his nose and see if there's any drainage or redness. And by this point in the assessment, he's probably going to be crying. So I can get a good look of the back of his mouth, his gums, if he has teeth, any problems he might be having in his mouth. While I'm up here by the head, you can do the 2 claps by the ears, and this is going to startle baby. It's going to trigger the Mora reflex. You can do the rooting, which is on their cheek. So after I'm done with his head, we're going to move down and we're going to listen to baby. So we're going to listen to his heart, aortic, pulmonic, Erb's point, tricuspid, and mitral. We're going to listen to his lungs. So you're going to do the anterior 10 and the posterior 10. And then you're going to listen to the 4 on the sides. And then we can listen to vowel sounds. So all 4 quadrants. Everything looks good. After I'm done listening, I'm going to move on to his pulses. Carotid, 1 at a time. Brachial, radial, femoral, and pedal. With this, you want to do each one at the same time so you can feel for symmetry, and it is all good. After we listen to baby and feel his pulses, we can move down and undo his diaper. So he is uncircumcised, and we're going to look at if there's any erythema, swollenness, anything at all. We can palpate the belly while we're here too, feel for any masses. While I have his diaper off, I'm going to go ahead and get his weight. stay with baby. I would also use a length board to get his length. You can go ahead and put his diaper wrap on. While we're doing the measurements, I'm going to go ahead and measure his head circumference. You're going to go around the back of the head and around the brow bone. Just good. And then you're also going to get the circumference of his little chest. And then we're going to get his belly, and we're going to get around the umbilicus. Make sure you get that diaper out of the way. Good. After we get his measurements, then we can do some range of motion, some abduction and adduction. His capillary refill, skin turner, it recoils. And after we get done with our general assessment, you want to return baby how he was, because he's probably cold. Cover him up and get him back to his mom and dad. Once you return them, then you can see if mom or dad have any questions, any patient teaching you need to do, any more concerns. After that, then you should be able to do your documentation and you should be done.